facilities in the Ashanti region are recording a dip in malaria cases. This is attributed to the scare of COVID-19 as patients fail to report to health facilities for fear their conditions may be linked to the virus. A report by Ibrahim Abubakar.
Malaria remains a public health concern in Ghana despite intervention by the National Malaria Control Program and other government agencies to control the disease. Malaria cases top the number of attendants at the outpatient department in almost all health facilities across the country. Efforts to fight malaria, such as free distribution of insecticide-treated nets, are gradually helping the country to slightly make progress in the reduction of cases. But the COVID-19 pandemic is diverting attention from the fight against malaria. More people with malaria-like symptoms are now opting to treating themselves at home instead of visiting health facilities for appropriate treatment. The fear of being isolated for COVID-19 when they visit the health facility with high temperature.
Just last week, I had some malaria symptoms like issues with myself, but I was very scared to go to the hospital because I knew immediately you get there, they will just use that thermometer gun to check your temperature and stuff, and they will be like, oh, the temperature is too high, so you have to isolate yourself and stuff. So I just went to the pharmacy shop and got myself some malaria drug.
Last when I was sick, I was afraid to go to the hospital. I just took some malaria herbs to cure myself because I was afraid. Because when you go to the hospital, you get infected.
Ariam Hospital records an average of 150 OPD attendants daily, with about 60% of the cases being malaria. But since March, when COVID-19 emerged, the hospital attendance has dropped by more than 50%. The rector of the facility, Dr. Gabriel Boache, is worried there will be an upsurge in malaria-related death if the trend continues.
If you have malaria and don't report to hospital, you are not going to get the right treatment, and mortality is likely to increase.
Ashanti Regional Health Director Dr. Emmanuel Tinkorang admitted the shift in attention to COVID-19. He attributed the low malaria cases recorded in its first quarter to low reporting of cases at health facilities.
It's rather unfortunate that the focus is on COVID-19, but we are still having malaria cases. So the malaria cases, from our first quarter report, you realize that most of these diseases, as if the cases are going down. But in reality, that's not the case. It's because people are not utilizing our services.
Dr. Tinkorang is urging the public to visit health facilities for medical attention. Countries like Ghana have committed to ending the malaria epidemic by 2030 under the Sustainable Development Goals, but this can only be achieved through political commitment and attitudinal change.